I'm John Kanellopoulos. I'm an ophthalmologist, and I'm medical director of our center here in Athens, LaserVision Institute, and clinical professor of ophthalmology at NYU Medical School in New York. Macular degeneration is unfortunately the most common problem in the civilized world that results in blindness or reduction of vision. Macula is the part of our eye that is inside the eye. And if you will, the whole eye works to focus images on the macula. Along with the images, though, a lot of light becomes focused on the macula. And sunlight carries a lot of energy, and that energy, through the pass of the years, starts to deteriorate the macular architecture. We, as eye doctors, separate macular degeneration in two different categories. The most common is the dry macular degeneration. We say dry because there's no blood involved. So in dry macular degeneration, we have certain spots in the macula that create holes, functional holes, not anatomical holes, and thus the patient starts to have an image that in the center is not perfect. There's varying degrees of dry macular degeneration. Most people go through their lives having dry macular degeneration, no other significant problem. Sometimes dry macular degeneration can turn into wet. We have vessels going through the back tissue of the retina, which is called the choroid, into the retina. And those vessels are very tiny. They're regular vessels, and they break and they bleed. The problem is that if scar results from this bleeding, that takes away all the cells that see. So we lose the vision that was produced by the area that has now been replaced with a scar. Unfortunately, there's not many symptoms in macular degeneration. Some people can notice when they see crosshairs, so maybe a French door, they may see those becoming wavy. Symptoms are usually dramatic when there's significant damage done by dry macular degeneration, or if there's a rapid progression of wet macular degeneration. Then patients see in the picture that they see a central black or gray spot that has no detail. As far as signs, meaning the things that we see as clinicians, it requires a thorough retina examination. And in dry macular degeneration, sometimes we can see a predecessor which is called drusen. These are white spots. They look like soft cotton spots in the center of the macula. If those have progressed, we can see those areas of atrophy. Then again, on wet macular degeneration, you can actually see the hemorrhage, you can see the blood in the center of the macula, and again, this requires a good retina exam. But we have other means today that are far more sensitive in picking early signs of macular degeneration. It used to be the fluorescein angiography, a test of taking pictures of the eye. Now there's technology, the OCT technology. It's a type of tomography, a picture that's resulting from thousands of sections of the eye. It's very easy for the patient, and it can give us clear pictures. This is an example of a tomography of the macula, and we can see behind the macula if there's collection of fluid. So this becomes a very sensitive tool for the eye doctor to be able to diagnose very early signs of macular degeneration. Unfortunately, it requires a thorough exam. For patients who have family history, I think a yearly exam after 55-60 is almost mandatory. Wet macular degeneration was a very serious problem with no treatment for many, many years. I practice almost 20 years now, and for the first 15 years there was no treatment for wet macular degeneration. The last 8 to 5 years we have a treatment which is an antibody. It's a little medicine that we infuse into the eye, and it can stop the oozing, the bleeding of the vessels, and can freeze the problem. The only negative thing of this treatment is that it needs to be repeated almost every month. So a lot of people who have wet macular degeneration for years may require 20, 30, 40, 50 injections of this medicine. It's a very easy procedure. It's done in the ophthalmology office, and as I mentioned, it can save vision for a lot of these people. There's no real treatment for dry macular degeneration. There's a lot of agents that are tried that may help. Some physicians have tried soft laser. Some physicians have tried soft photodynamic therapy. It's a type of laser with a photosensitizer that's injected through the vein. But in general, there's no clear treatment. We think that using vitamins, specific vitamins that help the eyes, can help a little bit. So whenever we see people in their 50s or 60s that may have the beginning of dry macular degeneration, we strongly encourage them to stop smoking, because smoking is a very significant parameter that makes it worse, and also to have good nutrition, have a special diet with a lot of antioxidants. They come from a lot of nuts, a lot of green vegetables, a lot of red vegetables, and of course supplementary vitamins. But there's no other clear treatment for dry macular degeneration currently. Well, as far as preventive measures, the knowledge that we have currently is avoiding exposure of our eyes to sunlight. So people who live a lot of their lives outdoors, either professionally or for recreation, we recommend good sunglasses that block UV light, preferably polarized glasses that even reduce energy further. For patients who may have predisposition or already have damage, we like to see sunglasses that also block blue light. Smoking is unfortunately a very significant participant in the progression of disease. And diet. Having a balanced diet that's full with antioxidants not only helps other vital organs, our heart, our brain, but also is very detrimental for the health of the eyes. And of course, patients who, or people who know that they have a significant family history of macular degeneration should be even more careful in this regard. As far as new horizons, there's new therapies that are coming out. Instead of antibodies that we mentioned, there's medications that are currently in use that are traps for the angiogenetic factor that creates all this vessel abnormality and turns dry macular degeneration to wet. And there's many agents currently under study that promise, we hope the promise holds true, that these injections do not have to be done every month, but maybe every 6 months or maybe once a year. But of course, we look forward to even more things that are currently in the pipeline and see if they turn out to be clinical things that will help clinically these patients. But we have to remember that 1 out of every 10 people that's over 65 will have problem with their maculas. So they have to have a good eye doctor to take care of them.